Hello, Nancy, and welcome everyone. How are you, Nance?
Good, Steph. How are you on this? Oh, it's actually an amazing Wednesday. More lunch. I
Lunch.
was going to say morning then, but no, we're lunch now. Yeah,
Yeah,
I'm
and you're
good.
you're a Melbourne gal as well, so
Yeah,
yeah, we haven't had the best weather, but hopefully it's going to get better very, very soon. I'm
let's hope
so
so.
happy to have you here today because we've got so many exciting things coming up,
Yes.
and obviously. You, my dear, are full of exciting news. You're obviously now a foundation member. Tadley's a foundation member of ABIC. Welcome and incredible support for the industry becoming a foundation member. Thank you so much for the wonderful, just how much you give back to the industry. I think we're all very appreciative of it. Very excited to have you on our team.
I'm excited to contribute and to be part of the team now. So yeah, it's really I think there's going to be a lot of changes that we can make together and grow the industry into a much more stronger and beautiful place. It's a really a great, exciting space and time anyway, but I think we'll do so much more over the next, 12, 24 months, however
Oh
long it
yeah,
takes.
for sure, and especially next year going into all the education reform that ABIC will be doing, and as a foundation member, how much obviously the degree of participation there is incredible for that reform. So we're really looking forward to it. But you're leading the way in so many ways. You actually taken on board. So obviously Tadley, everybody knows because you won Educator of the Year multiple times. So we know that you're an incredible educator, and your team is top notch, but people also need to know that you're a supplier to the industry. So you've actually got incredible devices that you supply to the industry, but also you educate for the industry. One of them that you've recently started venturing into is an incredibly dynamic field which is evolving, and that's electrology. Tell us how did you like get your eye on this and think, right, I'm going to start helping in this area as well?
Gosh, I learned electrology when I did my diploma a long time ago.
Yeah.
I can't remember how long ago now it was, but 20 something years ago when I did my like I said, my beer therapies. And back then it was actually a little bit tedious with the direct machine, but still there was a need for it. Um, but my love is and still is with IPL. You have to have that steady hand and patience for electrolysis
Yes.
until I came across the Dectro Apple's devices. And that was such a game changer because of the speed and also the lack of pain. So, I had electrolysis done. I don't know if you have had electrolysis done before.
Not yet.
Okay. Well, you will soon, hopefully. We'll
Yes,
get
at the
you onto that.
symposium, I'll be a model happily.
Yes, yes. We'll get you onto the bed. But I've had my eyebrows done years and years and years ago, and it was just very painful. But because of my eyesight, I was like, just get them removed, like the excess hairs. And then I had another round probably last year with Sterix, and I'm like, okay, that's a little bit bitey. It's sort of as we get older, I think I feel more too. But then I had the Apolis done on my eyes, on my eyebrows, and I was like, oh, wow, I can't feel a thing. And not only that, it was super, super fast. So it is that fast that your pain receptors don't even register the probe is in the skin.
Really?
So it's amazing, which means there's less fatigue for the therapist, there's less, pain and downtime for the client, the skin's not as red. And so once I had the treatment, I was like, okay, we need this. We have to have this. There wasn't a much awareness around Dectro and Apolis in Australia. And I thought, well, with our reputation and trust and our training, it just seemed like an amazing marriage. So
Oh,
we had to have it.
but everybody though around the world knows Dectro and Aquilus because it is a renowned device. So it is
Yeah.
one of the world's best devices out there. Well, there's a class of devices that's among one of
Yeah.
those very top-notch devices. So we're
Yeah.
very excited that you're, helping us to distribute that in Australia
Yeah.
and get the awareness up. And of course, we've got this electrology incredible first of electrology symposium in Australia,
Yes.
and that's in January. And we are selling tickets fast. So anybody watching here that is interested just to even expand their knowledge about electrology, because it is an incredibly in-demand field. We cannot keep up with the amount of clients wanting this. So if you want to expand your clinic, salon, or spa, please consider this. This is a way to grow your business very quickly and help a lot of clients that just don't respond to laser and IPL for various reasons. And what are those reasons, by the way, Nancy?
Oh, look, it could be someone who we're talking really high Fitzpatrick. So potentially they could be a Fitzpatrick 5 or a 6, and their skin just, isn't suitable for IPL or laser, right through to someone who is a fairer Fitzpatrick, a Fitz 1, 2, or a 3, and has white or gray hair, where, light-based devices just isn't, going to work on those fairer hair types. Or it could be where we've got, excessive hair growth after having laser, for example, and people are too scared to have any more laser, and they have the ability to permanently reduce hair, not reduce, actually, where legally we're allowed to say remove. So we're allowed to say remove hair with electrolysis. So yeah, it could be white, grey, red hairs that don't respond, someone who's scared to have that, that adjacent hair growing, or it could be a darker Fitzpatrick, especially with transgender or clients who've got PCOS or underlying hormonal issues. This is an amazing way to remove that hair permanently.
And also light hair, grey hair, white hair.
Yeah.
Like there is just no IPL or laser that really treats that effectively or at all. So we've got this incredible now, very fast way of doing it, very painless way of doing it, which is mind blowing because it's come so far. But your specialty is you do so many treatments. So you're the queen of like blending devices, different modalities. And as we know, like I have had clinics for, and this for, over 20, 25 years.
Yeah.
And what we do is combine therapies, and always a multimodal approach, but more holistic type approach. So one treatment doesn't really fix all of our, bits and pieces. Oh, we can get some really good, effects with one treatment, but usually it's a combined therapies and really holistic treatments that do the job. But timing is everything. So, because you're such a multimodal and multi-practice type therapist and also educator, I would love to know how you combine, mix and match, this putting in electrolysis in with all the other treatments that we do, lasers, LEDs, skin treatments. How would somebody who's considering electrolysis start with combining all of these things together?
Oh, look, I've been teaching combining modalities for, ever since I've been teaching, 13 years, and actually providing those treatments when I've had the clinics myself, and still do with the clinic that I have at the dermal space. For me, it's never about, like, say, the actual treatments or the number of treatments or the days apart the treatments. It's how to combine them properly. And also your treatment planning, like that's really important, knowing, what to do. If we're going to combine, say, IPL and electrolysis, how long do you wait in between those treatment times, or can they be done together? Which the answer is no, by the way. But I think the therapist has to have that foundational education on knowing when to treat, how to treat, on what skin types, is the skin prepped, and how long in between. So knowledge is the key. And actually, I'll be speaking at the symposium about treatment planning and combining modalities, when to, when not to. But really, it's having the knowledge of how to do it, but also having the knowledge when not to. And additionally, the third layer is if someone was to have a reaction, does the clinician actually know how to respond to that reaction? Because if you don't know how to respond to an adverse event to begin with, you shouldn't be doing the treatment, right? So I think it's all encompassing. It's when to, when not to, and if things go wrong, what to actually do and how to respond.
I feel like there's an epidemic of over treating in our industry. You know, we want to get in there and do everything all at once. And as you know, obviously, when you do that, you can compromise so many things. We're seeing a lot of people with barrier dysfunction or interruption in their barriers, a lot of inflamed skin, a lot of hyperreactive skins. When tell us about a little bit about that, and also going into the menopausal skin. When is too much too much?
Okay. And this is a fine line, right, between pushing the boundaries and safely. And I think that's really important. And pushing the boundaries and actually over treating. So if combining modalities isn't actually handled well, that skin can be pushed into that chronic inflammation. We don't really want that. And there's early warning signs like that sort of, clients when they're saying, oh, that heat's really lingering, or that redness in the skin has really sort of gone up a notch, then we know that we've pushed it too high. Or we could see that tightness or increased sensitivity in the client's skin. That's when you've over treated someone, and that's really important. And they can be quite subtle, but we as therapists need to know when we can push the boundaries, right? Or when the client actually has said to us after 3 days in particular. I think any more than 3 days, if the skin is inflamed and red for 3 days, we've done something wrong. But we need to listen to the client, look at their skin, ring them after the 3-day mark, and see how they're going. And if they haven't healed and repaired, then you need to go into that repair, barrier repairing mode, and get them under the LED, and provide treatments that are calming, soothing, and just really bring down that inflammation ASAP. And if not, then that's when we go and seek medical assistance from a GP potentially. That's your last, point of action. But sometimes we actually need to do that. So hopefully the therapist knows when enough is enough, and we don't ever get to that point. But I think that's when you push your ego aside and just ask for help.
Yeah, and we were talking as well about scope of practice. This is a big topic, a big issue, and obviously it's going to be a bigger issue next year when we start to do some more heavy reform to education, but also with the occupation, the work that we're doing behind the scenes on the occupations, which is still people think that it's kind of over and done with, but we're working to really define the scope of practice for a beautician cert, a diploma beauty therapist, skin therapist, and a dermal therapist and dermal clinician. That we have scopes of practice, but they're not either well defined, and they're not well communicated, and they're not mandatory. So I suppose being a senior therapist, you'd know your safe scope of practice. But for those out there that are, sort of in the gray area because they're more advanced therapists, they're not dermal therapists, considered technically dermal therapists, tell us a little bit about what you think about scope of practice, about, those that don't have medical oversights. What can they do to stay within that scope of practice? And what do you think about what scope of practice really is for a beauty therapist as opposed to a dermal therapist?
Look, it's so wide and varied. And I think that's where the problem lies. It's our industry, there used to be this real, not segregation, but I suppose there was such a little fine line between someone who does nails and someone who treats skin. And I feel like now there's more lash people do lashes, or not lash people, but lash, therapists do lashes, and your tanners, they now there's that segregation, right? And I feel like that's actually a good thing for our industry, because someone who does beauty, and I love beauty, I love getting my hair and my nails done and my brows.
Absolutely.
But that's what they're really focusing and finessing. Whereas I feel like skin, we're now really sort of evolving and growing, and skin clinicians or therapists are really learning and enhancing their skill by upskilling themselves, and going back to whether it's doing short courses or doing their diploma properly. or even their dermal therapies now, like, you know, at uni or at one of the TAFEs, I feel like there's more and more of that happening, which I think is really needed.
Yes.
I know myself, I've gone back to uni and it's
Just because
hectic.
you're
Oh
so
my God.
bored in life, you've got so much time up your sleeve.
No, I'm so time poor. But yes, thank you. Thank you for the reminder. But like I've learned so much, just the units that I've done, and they're basic units, mind you, but it is a real extension of what I learned, you know, so many years ago. And things have definitely evolved. Like when my sister was doing her dermal sciences at Vic Uni, I think she actually completed hers over 10 years ago, and I was living with her. So I was, you know, seeing what she was going through. Even from then, the curriculum has changed. So we don't ever stop learning. And I think that's where we need that CB. Oh, thumbs up. My Zoom agrees. That's where we need that professional development and credits for professional development in our industry. Like we don't have that. Why not? So I think if we can get something like that introduced, that would be amazing to make sure that, you know, we're always evolving, we're always learning. And so I think that's going to be really important. I think that's something
Absolutely.
that you're looking into, isn't it? AV
Yes, and
bionic
we'll love
ears.
your help with that as well.
Yes.
Absolutely. We're looking into so many things. Our survey, State of the Industry survey, has really shown where everybody's or the collective industries focus is on, and that's one of them that we're calling out for. So yes, we're going to be doing some work
I
together
have
on
read that. I have read
that.
that. So that excites me a lot because I just think we're always evolving and growing. And even though, you know, someone may have done their formal education, do they really stop learning in the workplace? They don't. And they should
No,
get
and we
credit
don't get
for
formally recognized for it. I mean, we do so much training in our industry.
that,
I mean,
right?
who that owns a clinic doesn't put their staff through regular training? And it would be great to get some recognition for that as well, and have that as part of your career progression.
Yeah.
There's so many things that we can talk about today. And today we're talking about, if you just joined us, because I saw a few more people jumping on, we're talking about many things. We're talking about electrology symposium, Nancy's forward thinking and very innovative approach to electrology. We're talking about combining treatments as well, because obviously Tadley has so many modalities happening. But tell us a little bit about, we're talking about, before we started talking about CPD, combined therapies and how you would go ahead and do that. So introducing then, electrology into this, what do you hear are the biggest myths? I would say let's do some myth busting about stacking treatments that you wish that we could all just bust and move on.
Oh gosh, there's a few things. I think the biggest thing was people are scared about stacking or combining modalities.
Yeah.
The thought was, oh, you know, too much heat, or if you're over sort of lapping modalities, you know, it's detrimental, and you're, you know, stimulating or synthesizing heat, you know, too many heat shock proteins. I think there's a lot of sort of things, negative attachments to those. However, if the skin has been prepared internally and externally, so if the skin has been, you know, they're using, you know, vitamin A, B, C, like, you know, Skin Individual, we've got all of that. If they're using maybe even a peel, and we talk about biomimetic peel, which is different to a normal peel, but if they're, you know, preparing externally the skin 2 to 4 weeks before, and also internal supplementation and hydration and EFA. So supplementation could entail we're really, as a human generally, we're actually low on zinc and magnesium, and vitamin D, of course. We're all vitamin D deficient. But if we can, you know, increase the supplements with that have those, biotin is another one,
Yeah.
essential fatty acids. So if we can get our clients to prepare their skin internally and, like I said, externally, and also educate the client on that little bit of extra downtime. I wouldn't say it's excessive downtime. And if we're then also able to, as a therapist or a clinician, target different depths of penetration. So to give you an example, I love performing my 4.5 mil HIFU with radio frequency, and then you finish it with some needling. And so
Wow.
that way, I'm actually targeting 4.5 mil. I'm targeting perhaps with RF, it might be 2 mil depth. And then I've got a mechanical trauma versus my two thermal traumas. And again, at maybe 0.5 or 1 mil. So I've got three different depths of penetration, all receiving three different types of trauma is a bad word, but it's actually what you're doing, isn't it?
Simulation.
So
There you go.
controlled trauma, right? So we're targeting the three different depths. And like I said, if the client's prepped psychologically and physically, the outcomes are actually quite transformational. And
Really?
so I think, and that's why, I love pushing the boundaries safely, but we're targeting different depths. And I know combining modalities used to have a bad vibe attached to it, but a lot of the symposiums and the conferences that I've been going to over the last, say, 5 years have been more and more talking about combining modalities in customization. Like, who doesn't want a customized treatment?
Absolutely. I mean, they're doing a lot of that in Korea. People are flying over to Korea to have these combined modalities. And you're right about prepping. I mean, we've got so many things that, look, we're talking about also younger skins can tolerate it a little bit more. Older skins, you need to be a bit more careful. But we've got lots of things that we can do to prep the skin before and after, but also including LED and low level laser. Those things can mitigate the duration of the initial trauma by, if you do it pre and post, you can actually bring down inflammation. And it's the prolonged inflammation that you're talking about that's the problem. It's not the instantaneous inflammation and stimulation that's the problem. We want that. We just don't want the lasting long type of,
And
so I think what you're doing is so smart. I've always been a proponent of that. I do think as you get older, you need to be extremely careful with heat-based devices. And that's why you're an expert in that. And that's what part of what you'll be teaching at the symposium. And this is why we're so excited, because you come to this symposium, you're not just going to get electrology. You're going to get a lot more than electrology. You'll have electrology as the feature, and you'll learn more about this modality, but you'll learn about how you can successfully combine all of these incredible modalities, the way that, is trending overseas from experts like Nancy. Nancy, can you please share a little bit of insights, a bit of teasers, don't give too much away, but what can we expect when we attend this symposium?
It's going to be actually amazing. So I think just the lineup, if anyone hasn't heard about Joanne Gonella, she is the world's leading electrologist. She's a mastermind when it comes to electrology. She'll be presenting, she'll be flying all the way from the US. Yeah, so this is amazing that she's coming, and she'll be talking about galvanic, thermolysis, blend methods. So she'll explain the basics, and then going through to advanced, the follicular anatomy and how current flows through the follicle, and also with hairs that are resilient or resistant to traditional electrolysis, pushing those boundaries. She's also going to be talking about recognizing and preventing overtreatment with electrolysis. I've seen, and I'm sure you have too, seen scarring, especially around the chin area where, people have misplaced their probe. And so she'll be talking about avoiding that too, because that's a real thing. So skin injury science, the healing of the skin. She'll be going through, treating those resistant hairs and how to overcome those treatments, or not the treatments, but the resistant hairs. Also, I know she's going to be talking about treating different body areas. So, participants will be able to gain confidence with that. And then after, that's not enough. And after that, we'll also be hosting a 2-day electrology masterclass. So it's like 100% hands-on. It's about 10 hours of hands-on experience. We've got about 8 beds. So there is limited space. I think we've half sold out already. So I think there might be another 8
I think
places.
more than that. So if everybody, if you're listening now and you want tickets, now is the time, because they are starting to pick up and sell fast. So
yeah. So I think with
if you want that hands-on experience.
Yeah, so I know with us, we've sold the Tadley 2-day masterclass. We've only got a few spaces left, but
Wow.
with ABIC, I think even that we've I can't believe how many tickets we've sold already. That's been amazing.
So
So
good.
yeah, so ABIC symposium paired with the Tadley masterclass, like people will walk away with this newfound confidence and they'll feel like they're experts and they can just take that knowledge and the hands-on back to their clinics and just run with it. Because like you said, electrology has just, I don't know, it's boomed. It
It's
really has.
completely insane. Like we have calls, we just don't have enough therapists out there to fill the
Yeah,
demand, and I don't think we will anytime soon. So your
yeah,
books will, the minute you advertise it, your books will fill up very quickly. I think also this symposium is incredible because it's the way you've you know, and especially I have to shout out to Karen Miriam Di Gonzalez, who has organized this conference. She is the convener of the conference, so obviously she's an ABIC council member, and she's done so much work to pull this together. So thank you so much, Karen, who you're watching,
thank
for all
you,
the work.
Karen. I know
Um,
you've been like a powerhouse,
the
like pulling
queen.
this, pulling it
Oh,
all together. Amazing.
yeah, really, really great work. But the way that it's structured is if you're a beginner, you can walk away with everything you need to start this. If you're an advanced electrologist, you can sort of pick the things that you want in there to advance yourself even further. So it is actually for both beginners and advanced,
Yep.
which is an incredible way of setting this up. It's very hands-on as well, but there's heaps of theory and then you put it into practice. You just walk away with this incredible confidence, and the experts in the room, like, and such as yourself and so many other experts that we have gathered together. It's the 11th and 12th of January. There, if you're a non-member of ABIC, it's $3.99, but if you're a member, it's $2.99. So really, you can join up for $99 a year,
Yep.
and then get your $2.99 ticket. So you get an ABIC membership with it, basically. So if you're out there and want to learn more, please go into our Instagram or Facebook. There'll be a link to the page. You can buy tickets from there. And if you've got any questions, just email us as well. Nancy, I'm so excited to to see you in January. We're going to have so much
Yes.
fun.
Yes.
And thank you so much for your time today, and for being a foundation member of AVIC. You guys are pretty awesome. I love your team. Can't wait to spend time with you in January.
We can't wait either. So thank you for, to Karen and for yourself for making this happen. I know it's been a long time coming. We haven't had one, if ever, if I don't think
Never.
ever actually. So
No.
this is really exciting. And I think for that price point, $3.99 for two days, not one day,
Yeah.
2 days of information is actually a bargain.
Oh
If I
yeah,
can
two
say
days of
that.
information.
It's
You
a
get fed,
bargain.
you get, wined and dined.
Yeah,
It's all happening at this
yeah,
conference, and it'll be
yeah.
such a great experience of networking as well. You get to find your community and people that you can bounce ideas off, and I think it's just going to be a really upbuilding experience for everyone. So can't
Yep,
wait.
yep. So can I just add in a
Yeah.
cheeky, if anyone is a Tadley follower, we do have a discount code. Can I say that?
Yes,
We
of
do
course.
have a
Love
discount
it.
code. If you use Tadley 10, it'll give you a little discount. So hopefully you can bring yourselves and the rest of your team along. It's going to be really exciting. I think if you're looking for a device, this is another reason to come, because we've got, I think there's probably about 3 or 4 other device suppliers there. So you'll be able to see everyone's devices and even perhaps try them to see what they all look and feel like. So I think it's a really good way if you're looking to buy a device. Like Steph said, if you're just jumping on board because you're learning and you want to learn more, or even advanced, we always learn, and it's like a bit of a little mini refresher course, plus there's going to be advanced knowledge there as well. So it's a nice all-rounder, like you said.
Oh, well, I look forward to seeing you there and everyone
Me
else there. And
too.
thank you so much for
Yes.
joining us today. It's always
Thank
a pleasure
you.
to chat.
Yeah, thanks, Steph. All right,
Bye,
thanks,
Nancy. Bye,
everyone.
everyone.